COVID-19 cases are on the rise around the world, with more than 3 million new infections reported in the last week. That brings us up to more than 124 million cases worldwide. And while data from the World Health Organization shows the numbers are trending in the wrong direction, there is new hope when it comes to more treatments to fight COVID-19. So for more, let's bring in Dr. Susannah Hills. She is a pediatric airway surgeon and assistant professor of ENT at Columbia University Medical Center. So, Dr. Hill, that data from the World Health Organization also shows that deaths around the world are plateauing after decreasing over the past 6 weeks. We don't like plateauing. Vaccinations are helping, but we saw people partying without masks in Florida this past weekend. So many cities and states are lifting COVID restrictions, while that is happening. In your medical opinion, are businesses and cities opening too early? And where do you see the number of cases going at the current rate?
It's a challenging balance right now because vaccinations are going well. But what I hope we're learning from this whole pandemic process is that, we have to be looking at the situation globally. What's happening in Europe, what's happening in Asia, what's happening around the globe affects what's happening here. And when we see cases going up by 3%, and a large number of those cases being attributable to Europe. And throughout the pandemic, what's going on in Europe tends to happen here in the U.S. just a couple of weeks later. We have to be thinking we could be experiencing in the United States exactly what's happening now in Europe with surges and increases in cases. There are a number of countries in Europe, Italy, France, Germany, that are in lockdown or considering it. So we've got to keep that in mind, and we've got to be looking at what's going on around the world. Right now, with the cases going up in Europe and also with cases here in the United States plateauing and going up, Michigan last week had a 30% increase in their positive cases, and yet they continued with their reopening measures at the end of last week. We've got 17 states without mask mandates anymore. We have got to press pause and think about how we're approaching reopening in places where case numbers are plateauing or increasing.
So, Dr. Hills, let's talk some practicalities. For example, New York State just announced that 50-year-olds can become vaccinated, which is great news for those of us who are in that age group. And I'm wondering, though, if you are fully vaccinated against COVID-19, and you decide to travel abroad. I was texting with a friend, a very close friend in Paris, and she says that, as you pointed out, that France is going back on lockdown, and that the rate of vaccination in Paris specifically has been very, very slow. Less than 1 million people, she says, have been vaccinated, and she's not anticipating receiving a vaccine until much later this year. So what does that mean for those of us who are vaccinated if we choose to travel abroad? Could we be susceptible to a variant of COVID-19 that we're not sure if the vaccines that we've taken here will protect us against?
That is a great question, Vlad. That is exactly the question that is incredibly important as we move forward. The data we have right now does not show how long protection lasts for or the durability of the immune protection from getting a vaccine. And we're seeing in studies that are coming out that people who either got immunity from being infected or people who have been vaccinated are having reinfections. If you look at our initial data from the Pfizer and Moderna vaccine studies, those studies weren't 100% effective, right? We've got 95% protection against clinically severe or significant illness. That means 5% of people still got significant illness, and we don't know how many others were infected asymptomatically and able to transmit the virus. So it is a concern. We don't know the answer to that yet, but we have evidence to show that it's highly likely that people who are vaccinated do have some level of possibility of transmitting the virus, and they definitely can still get sick even though the chances are low.
I want to talk to you about Regeneron's COVID-19 antibody cocktail. They did some late-phase clinical trials, and the results are in. Now, people may remember that Regeneron was the drug that former President Trump took when he was diagnosed with COVID-19. So the results of their research are that the treatment, when given at a lower dose than originally authorized, is actually 70% effective at reducing the risk of hospitalization and death. Regeneron's researchers also found that it shortened the duration of a patient's symptoms by 4 days. What advantages could this treatment have for patients who are experiencing more severe versions of COVID?
Yeah, you hit the high points right there, Anne-Marie. It decreases hospitalization and death significantly. That's huge. That's the end point we want from treatment. And it decreased the length of symptoms by 4 days. The other key to this particular drug is that this is a study where it was given outpatient. So it's a medication that could potentially and is likely to be very effective in keeping people out of the hospital, in preventing hospitals from being overwhelmed, in keeping people from progressing to the stage where they need really acute care. So that is a huge benefit. And I think as we look at the longevity of this virus, it's not going away. We're going to continue to have cases, and as well as our vaccine rollout is going here in the U.S., there are many, many other countries in the world that will be dealing with active illness before their populations get effectively vaccinated. And modalities like this to treat the disease are still incredibly important. So yeah, it's thrilling to see Regeneron come out with this medication that can be outpatient, that's super effective in this study anyway, and that can potentially be given also, by the way, at much lower doses than they thought. So you can potentially treat more people with the same dose that they were giving before.
Really important information as always, Dr. Susannah Hills. Thank you, Dr. Susannah. We appreciate it.
Thanks so much.